Have you ever wondered about the labyrinth of the human mind and how sometimes it can create a world so different from our shared reality? Today, we are delving into the world of schizophrenia, a complex and often misunderstood mental health disorder. What is schizophrenia? It's a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. Often, individuals suffering from schizophrenia may seem like they have lost touch with reality, which can be scary, not just for them, but for those around them as well. So how do we diagnose schizophrenia? The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, or DSM-5TR, provides the standard criteria for diagnosing this complex disorder. A diagnosis of schizophrenia requires 2 or more of the following symptoms to be present for a significant portion of time during a 1-month period: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms such as diminished emotional expression or avolition. Furthermore, for a diagnosis, one of the symptoms must be either delusions, hallucinations, or disorganized speech. Continuous signs of the disturbance persist for at least 6 months. This 6-month period must include at least 1 month of symptoms and may include periods of prodromal or residual symptoms. Now let's talk about the causes of schizophrenia. It's a complex interplay of genes and environment. Genetic factors make an individual susceptible, but environmental factors trigger the illness. Things like exposure to viruses, malnutrition before birth, problems during birth, and psychosocial factors can trigger the onset of the disease. The symptoms of schizophrenia are broadly categorized into positive, negative, and cognitive symptoms. Positive symptoms are those that most individuals do not normally experience but are present in people with schizophrenia, such as hallucinations, delusions, and thought disorders. Negative symptoms are associated with disruptions to normal emotions and behaviors, such as reduced expression of emotions, reduced feelings of pleasure in everyday life, and difficulty beginning and sustaining activities. Cognitive symptoms involve problems with thought processes, including problems with making sense of information, difficulty focusing, and problems with working memory. Treating schizophrenia is a lifelong journey. It usually involves a combination of medication, psychotherapy, and coordinated specialty care services. Antipsychotic medications are the cornerstone of treatment, while psychosocial treatments can help manage the everyday challenges of schizophrenia. Coordinated specialty care includes psychotherapy, medication management, case management, employment support, and education. Schizophrenia is not a life sentence. With the right treatment and support, individuals with schizophrenia can lead happy, fulfilling, and productive lives. With a better understanding of this disorder, we can break down the stigma and provide the support that these individuals need. So the next time you hear about schizophrenia, remember, it's not just a disorder, but a different way of experiencing the world. Understanding and empathy can go a long way in making that world a little less scary.